today's lecture we are going to cover the material that can answer the question whether low carbohydrate and high fat diet influence endurance performance. Okay, the low carbohydrate and high fat diet decrease endurance performance. That has been reported before. Okay, it has been demonstrated in 1965 based on this paper. So this is the muscle biopsy study, and it was conducted under 3 conditions. Mixed diet means the dietary habit doesn't change, and high protein, high fat diet for 3 days. High carbohydrate diet for 3 days. The carbohydrate is 80%, and this is just reverse. Okay. And then that is going to create 3 different levels of muscle glycogen. So as you can see, this is the glycogen. You can see the dot here. This is protein, fat, high protein, high fat, right? So it gives the low muscle glycogen in human skeletal muscle. Okay. This, the cross, is high carbohydrate diet for 3 days. Then it produce high level of muscle glycogen. And you can see this is the work time at 70% Vo2 max. Okay, that is the time. And you can see a very beautiful linearity, right? That gives you the idea that 3 days dietary intervention will produce different level of muscle glycogen, and it would dramatically change the endurance time in moderate to high intensity. Okay, so the answer is, for the short term, yes. The answer is yes. But for long term, the condition may change, because for long term, the human body are able to adapt. So we want to know when you'll be able to adapt, and whether or not your muscle glycogen will recover from low carbohydrate diet. Okay, so the short answer to answer the question is, it depending on exercise intensity. Okay, so I will explain that later. Okay, so the question is, does low carbohydrate diet change endurance performance? And for short term, the answer is yes. For long term, depending on the exercise intensity. And also, you want to know that the human body are able to adapt to dietary change. So you want to ask whether the question you ask are immediate effect or long-term effect. And you understand for immediate effect, the answer is yes. Low carbohydrate is going to undermine your muscle glycogen and reduce your endurance performance. A long-term effect is quite variable. And one of the reasons is because the human body are able to adapt. Then I will explain the reason why. And before we enter this topic, I want to give you some explanation about the popular term that has been used recently, which is Ketogenic Diet and Atkins Diet. Okay, these are very popular diet that has been prevailed for certain period. And you know the Atkins Diet, right? Atkins Diet is a professor worked for Harvard University, And he's promoting what? He's promoting low carb and high protein. Okay? How about ketogenic diet? What is the definition of ketogenic diet? Ketogenic diet means the diet that is able to increase your plasma ketone level. Then we call it ketogenic diet. Okay, what kind of dietary condition is able to increase your plasma ketone level? Yes, high fat. What else? You want to preclude anything that would increase the ketone.
Low carbo.
Right. Low carbo, right? Because carbohydrate is going to induce insulin secretion. And the insulin secretion is going to induce glucose transport across plasma membrane. And therefore, when cell receive glucose, the ketone body is going to be very low, right? So you don't want to have anything that induce your insulin secretion. So you want to have low carbohydrate. How about protein? Moderate, yes, very good. You don't want to have high protein. And the reason you don't want to have high protein is because the protein can also lowers ketone body by increasing insulin secretion, especially when you have some amount of glucose. If you have small amount of glucose and you have protein, that would also induce some insulin secretion, and that would in turn lower your ketone body. Okay? So if you want to say, does this is protein plus fat, right? We can only say this is similar to ketogenic diet, but it's not ketogenic diet. Okay? So you want to know, ketogenic diet is very low carbohydrate and high fat and moderate protein, not high protein. Okay, so I will show you the data to give you the idea that if you increase the protein to 20%, then the situation changes. You don't have high ketone. The ketone body level is suppressed. Okay. And I want to emphasize that this is very low carbohydrate diet. Okay, what do you mean low carbohydrate diet? Okay, let me ask you the question. 30% carbohydrate of the energy from your diet, do you consider this as ketogenic diet? It's not, right?
Yes.
30% is low carbohydrate, but it's not ketogenic. Because if you have a glass of orange juice, the ketone is going to suppress, right? So low carbohydrate diet does not equal to ketogenic diet. Okay, and you also understand that the glucose and insulin has synergistic effect to produce insulin. Like you understand that carbohydrate is the most potent macronutrient, stimulate the insulin secretion of pancreas cell. But if you have some protein, it would have additive effect to stimulate the insulin secretion of the beta cell pancreas. So that is the reason why you want, if you really want to have high ketone produced in your body, then you need to almost totally suppress your carbohydrate intake, and you don't want to have a high protein. Okay, and also I would like to show you that the reason that Atkins diet is vanished, right? It was popular, right? It was popular. And what is the theory behind Atkins diet? There are many people saying that the human learn how to crop, right? And therefore you can produce carbohydrate. But that is not happening recently in human history, right? Within the most 10,000 years, then human already know how to crop, right? But the human has been surviving on Earth for more than million years. So that means that most of the time, the human cannot produce high carbohydrate. They cannot produce crops, right? And therefore, there are some people, they are making hypothesis that the original dietary condition for human is mostly rely on fat and protein, right? So that is a theory behind high protein and high fat diet. But if you look at the longevity of Robert Atkins, what is the longevity? 72, 72, 73, right? Is that long? The average lifespan in Taiwan is 78, right? So it's shorter than most of the country, right? So that means if you really know the principle of the diet, then you should be able to make yourself survive for a longer period. So that is the most important thing. You need to demonstrate at least yourself. And now these people start to case out to the Atkins diet. How about ketogenic diet? Is there any evidence saying that the ketogenic diet is not poisonous, is okay for everybody, and is not going to compromise your lifespan? High fat diet, high fat and moderate protein diet, low carbohydrate. Can this kind of diet influence your longevity? So this is also the question we are asking, and I will give you the answer later. Okay, now get into the ketogenic diet. Okay, this is the ketone body in your blood. Okay? So if you have nutritional ketosis means you have very low carbohydrate diet, very low carbohydrate, and high fat, and moderate protein. Okay? Then you have nutritional ketosis. And what is the level of the ketone blood? Nutritional ketosis, 0.5 to 2 millimole beta hydroxy butyrate or acetoacetate. These are the major ketone body in the blood. And the ketone body is from acetyl-CoA, right? So everybody know, right? And when you don't have glucose, then you would cause accumulation of the acetyl-CoA, and those acetyl-CoA are converted into the beta-hydroxybutyrate and acetoacetate. So we collectively call this as the ketone body. Okay. So when you have nutritional ketosis, the level can reach 2 millimole. When you have starvation, okay, so if you don't eat food for 1 week, then you start to have what we call a starvation, and that would also increase your ketosis. And the ketone body level can reach 5 to 10. Okay, so is this dangerous for you? 5 to 10 millimole per liter. The answer is not dangerous. You can still survive, no problem. So starvation is not life-threatening to you. Okay. How about ketogenic acidosis? This is dangerous condition, and it's normally happen when you don't have enough insulin secretion. So if you don't have insulin secretion, for one example, type 1 diabetes. Type 1 diabetes is featured by no insulin or very low insulin secretion. And the insulin is it's the stimulator for the glucose transport across the membrane. And therefore the cell can get glucose. And therefore you don't have the accumulation of the acetyl-CoA, right? Then you don't have high ketone body in your blood. So if you have insulin, then you have low ketone. But if you don't have insulin for a long time, for example, type 1 diabetes, then you have very high ketone to the level reaching 20 millimole. Then the pH of the blood is going to change. So that is the condition we call ketogenic acidosis. That is very dangerous for people. Okay. But I want to say that even you fast yourself for a week, you won't reach that kind of level for normal people because you are producing insulin still. Okay. And if you don't have carbohydrate, can you well survive? The answer is yes. But then the question is, the people usually know that, most of the people know that brain is glucose consuming organ, right? Can brain cell has beta oxidation of fatty acid? No, right? So the reason one of the reasons we need to have high carbohydrate or carbohydrate is because we believe that brain only take glucose, right? But how about under starvation? When you have starvation, then the brain still needs glucose, but the brain can also rely on ketone, right? So if you have a ketone, the brain can still use the ketone to produce ATP. Okay, even 1/3 or 2/3 of the energy coming from ketone, the brain can still survive, no problem. So that means the glucose is not absolutely required for brain. Although brain would prefer glucose, but ketone can still maintain your brain function. So that is the reason that we don't the starvation for 1 week doesn't straighten our life. So that is the main reason. Okay. Another thing is, if you have low carbohydrate diet and high fat, how do you maintain your blood glucose? Can you maintain your blood glucose on the very low carbohydrate and high fat? The answer is yes, you could do that. And how do you do that? You have only 5% of energy coming from carbohydrate. How can you maintain your blood glucose? What organ in human body can produce glucose? Liver, yes. Good answer. Number 1, liver, and kidney. Number 2. Okay. About 10% of the glucose can be produced from kidney, but most of them is produced from liver. Okay, so liver and kidney can produce glucose from non-glucose substrate. Okay. And therefore you can always maintain your blood sugar even with very small amount of carbohydrate. Okay. So now you understand that ketone is one of the fuel that you can use in human body and it's quite safe unless you are totally eliminate your insulin. Then you have too much ketone, that is no good. So too much ketone and too much glucose is not safe for human body. Okay? You already know that if you have glucose that is too much, it's also toxic. Ketone is the same. Okay. Another important background for you related to the exercise intensity is this. I already give you the data when we have the previous lecture. Okay. So from here you have 3 different exercise intensity. 25% Vo2 max, 65 and 85% Vo2 max. Okay. So we have 3 conditions. And you can see the energy is coming from where? During high intensity exercise, right? So on the high intensity exercise and moderate intensity of exercise, the energy is coming from where?
Glycogen.
Yes, glycogen is the major fuel, right? So this is the highest proportion, and this is muscle glycogen, and this is the major proportion, muscle glycogen. How about muscle triglyceride? Number 2, the triglyceride stored in the muscle is the number 2 fuel, right? So it helps, but not much at high intensity. But for low intensity or moderate intensity, the muscle glycogen will help. Okay, so you expect that if you have any way to change the preference of the muscle to store glycogen and triglyceride, is also influence what kind of influence your endurance, right? But it really depends on what exercise intensity you are choosing, right? So if you are choose very short period, high intensity endurance performance, or you choose the cycling for 3 hours, 6 hours, it's going to be different, right? If you cycle for 6 hours, what kind of intensity? If you do cycling, if you do marathon, okay, what kind of exercise intensity you are low? Can you do this for half marathon? It's difficult, right? So you're going to choose anything lower than 65%, right? So if you want, so that's why I say that if you want to answer the question here, does low carbohydrate diet change endurance performance? When you have that, then you also want to ask, what kind of exercise intensity, right? So this is very important for you to, important background. Okay, then another question. If you have, for example, 3-hour exercise, when you finish the exercise and you look at your muscle glycogen, it's going to be very low for a long time, right? And then if you don't give any food, if you have fasting, then can your muscle glycogen recover? It's a very important question. And I was surprised when I see the result when I was graduate student. Okay, you exercise and then you recover without any food. Can muscle glycogen recover? What is the answer? Yes or no? Okay? So if you look at the white muscle is the muscle that has very few mitochondria and capillary density. Then exercise fast, it's not recovered. This is the glycogen, right? It's not recovered. But if you look at the red muscle, the muscle that has a lot of capillary, then you see the glycogen recovered by almost 100% of the baseline level, of the exercise level. Under fasted condition, then you ask the question, where is the glucose from? If you don't eat anything, but your muscle is recovered, muscle glycogen is recovered, where's the glucose from? From gluconeogenesis in liver, right? So liver are producing glucose to maintain your blood sugar, and therefore your blood sugar is always maintained, right? And the exercise muscle, especially for those muscles that has capillary, then they can still take some glucose, and therefore you see glycogen recovery under fasted condition, but not for white muscle, okay? Okay, these are important background for you to understand the evidence later. So I would like to give you a study related to fat-rich diet, high-fat diet. Okay, so let's look at what kind of the diet they have. They have carbohydrate and fat. Okay, so if you look at the dietary profile is 3:1 ratio. Okay? So you can have the high-fat diet. And then if I ask you the question, is this high-fat diet ketogenic? For this ratio, 3:1. High-fat diet, right? The fat, this is fat, right? Fat content. High-fat diet is 3:1. This is carbohydrate diet. So if I ask you the question, this is obviously the high-fat, right? Percent energy. Percent energy, 61% of energy is coming from fat. Is this diet ketogenic? The answer is no, because you still have 21% of the energy is coming from carbohydrate. You only 1 glass of orange juice is going to lower your ketone, right? So you want to keep in mind that the ketogenic diet is not only low carbohydrate, it's very low carbohydrate, and this is not ketogenic diet. Okay, this is low carbohydrate and high fat diet. Okay, the protein level is similar. 14, 13, similar. Okay. Then if you are feeding those diet for 4 weeks, then how are those diet influence your endurance performance? Okay, then if you look at here, you can see this is baseline, and then 2 weeks later, the high carbohydrate diet has relatively higher time to exhaustion compared to the high fat diet. So this also demonstrates that the high fat diet is not good for your endurance performance in 2 weeks. Okay? But if you look at week 4, then you do not see difference. Right? So what does it mean? This means that if your body has the high fat and low carbohydrate diet for 4 weeks, then your body can somehow adapt this condition. And what is the mechanism behind this? How do you adapt? Make a guess on the muscle glycogen. You understand that the endurance time of your muscle is correlated with muscle glycogen, right? So make a guess about glycogen 4 weeks later. Okay, look at here. This is the muscle glycogen. 4 weeks later, the high carbohydrate diet has relatively higher muscle glycogen, right? But the high fat diet has the muscle triglyceride level about 80% higher than the high carbohydrate diet. So we should say that what is the percentage of the difference? glycogen difference? What is the percentage difference? 20% in glycogen. It's not much, right? It's not really much, but the triglyceride can reach about 80% difference. Right, so it's compensating. So actually from here you know that does high-fat diet reduce your muscle glycogen? The answer is moderately, but not much. How about muscle triglyceride? Big difference, 80% difference. Okay, this is another study. They are endurance athletes. Okay, so they use also high fat and low carbohydrate diet. So they are comparing high fat diet and high carbohydrate diet for 5 weeks. Okay, you understand that 4 weeks we already adapt, right? And this is 5 weeks. This study is better designed because this is randomized crossover design. And this is the profile of the dietary intervention. Okay, then this is high-fat diet. That 50% of the energy is coming from fat, and 30% of the energy is from carbohydrate. And protein are the same for both. Okay, so the low-fat diet is quite normal. 68% of energy is from carbohydrate. Okay, let's look at muscle glycogen. So 5 weeks, no difference in muscle glycogen. So that means if you have high-fat diet, then at the beginning you have low muscle glycogen. But later on you have adaptation. You start to minimize the difference of muscle glycogen between high-fat diet and high-carbohydrate diet. So human body are able to adapt. Okay? And this is the muscle glycogen content. High-fat and low-fat, they are almost the same, right? Less than 10% difference, no significant. How about Vo2 Max? No difference. So high fat and low fat diet has no difference in power, no difference in Vo2, no difference in lactate, right? Where's the lactate from? Yes. That's right. Glycolysis, it's not compromised. Muscle still get enough muscle glycogen. You have enough muscle glycogen. And if you have high-fat diet and you have enough muscle glycogen, you understand that where do you get your glucose for your muscle glycogen under high-fat diet?
Gluconeogenesis.
Yes, gluconeogenesis. Perfect answer. In liver, right? The most important gluconeogenic organ is liver and kidney. And liver are 90% from it. How about RER? Okay, this is RER. RER is respiratory quotient, right? So understand that. Under resting condition, if you have a high-fat diet is triangle, right? And you have lower RER compared when you have high-fat diet. So under resting condition, so most of the condition is consuming more fat, right? When RER is low, represent the energy used is more rely on fatty acid, right? And why this is the case? It's related to one hormone. If you have a high-fat diet, kind of hormone, what kind of hormone is going to influence your carbohydrate metabolism? Insulin, right? If you have a high fat, your insulin level is always low, right? So when insulin is always low, then the insulin will not be able to cause lipogenic effect. The most important lipogenic hormone is insulin. Right? Insulin help glycogen synthesis, help triglyceride synthesis, DNA synthesis, and protein synthesis, right? And it's very important to lipogenic effect. If you don't have insulin, the lipogenic effect is going to be very low, and therefore most of the fatty acid is dumping out of the fatty, your adipose tissues. So that's why even when you have the high-fat diet, you don't get fat because of you have low insulin, right? Okay. But when exercise intensity increases, then you see the difference disappear, right? So this means high intensity, you cannot sustain high intensity exercise without consuming carbohydrate, right? So carbohydrate is important for high intensity. Then you can answer the question, does high-fat diet compromise your endurance performance? Depending on exercise intensity, right? For low intensity exercise, you do not see difference. Okay. No difference in half marathon running time between high fat and low fat diet. And the lactate is like this. Okay. No difference. Okay, then the answer for the question, does high-fat diet decrease endurance performance? The answer is yes. Only for the first 2 weeks. Okay, but adaptation occurs in about 4 weeks, and that will compensate your muscle glycogen storage. But performance will not be better. Okay? Adaptation just recovery. It does not make you better. Okay? So high-fat diet does not read, although you have adaptation, and adaptation looks like you can store more fat in your skeletal muscle, but that doesn't improve your endurance. And high-fat diet moderately increase lactate accumulation during aerobic fitness test. No no difference in performance. Okay. Ketogenic diet. Ketogenic diet will not improve high density endurance performance. And you know the definition of ketogenic diet. You have to see the data on ketone, beta hydroxybutyrate. Okay. So you want to have the diet that prevents insulin rise. Okay, so not low fat, high fat, low carbohydrate diet is not enough. You want to have high fat and extremely low carbohydrate and moderate protein to achieve the level that can increase beta hydroxybutyrate. And that is largely related to insulin. Okay. Okay. What is the drawback of ketogenic diet? What is the disadvantage of ketogenic diet? Well, most of the cohort study of ketogenic diet is conducted in epilepsy patient. You know seizure, right? Some of the kids get seizure, and if you give the ketogenic diet, 50% of the patient will recover. So you can have a lot of data from the children that has seizure. And these are the results. The ketogenic diet will lower weight and height gain. And you understand why, right? Because ketogenic diet gives you low insulin, right? And the insulin is required for growth. Right? Insulin is anabolic hormone, and therefore you grow slowly in children. Okay, and this is the Z-score compared to the normal children. And if you have the ketogenic diet from the first month to 15 months, okay, you can see that 15 months of ketogenic diet will make your height far away from normal. 0.3 to 0.13 minus, right? So you slow down your growth. Normal kids will grow, right? If you have ketogenic diet, you grow slowly. Weight is the same. For adult, most of the adults will be very happy about this result, right? Because I'm not growing. Good, I'm not aging. And I looks fine, right? But for kids, some of the kids, this is concern. And another thing is, we have covered that the insulin are very essential for bone growth, right? So in these kids, they also found that the bone mineral density decreases for children under ketogenic diet. And also the wound healing time get longer. And why this is related to the bone mineral density. Because you understand the bone is not only a supporting connective tissues, right? Bone produce what? Stem cells and immune cells, right? The immune cells help you to eliminate the aged cell. Stem cells are required for regrowth, and therefore the bone can always renew, right? Renew very fast. And if you don't have the mechanism, then the bone is very difficult to renew and growth, right? So this is the drawback of the ketogenic diet. So let's conclude for the ketogenic diet. Another thing is bad breath, right? If you don't have carbohydrate, then you have the ketone smell, right? And the ketone smell are socially less welcome, right? So that is one thing. And bone health. And another thing is constipation. Constipation. Sometimes some people, if you give some sodium, then the constipation would disappear. And we want to warn that it's not suitable for elderly at the stage of unintentional weight loss. You understand that one of the reasons that the muscle mass, bone mass will drop for those human aged more than 70 is largely because of the insulin level is dropped during that period. And if you have a ketogenic diet, that insulin is even lower. So it may not be good for those people, especially for maintenance of the bone. Okay. Now we need to come to the question. We answer the question about short term, about your physical performance. So you already know the answer for what is the advantage to have high fat, low carb diet. And now we ask longer term question. The low carbohydrate, high fat diet. Is that good for your longevity, aging? Okay. This is the paper published in Lancet. Okay. Also on BBC, right? Report this paper. And this is an observational study. Observational study, you know, what is observational study means? Okay, we have a big population, and some people, for some reason, they use high carbohydrate, and some people, they prefer high fat. Okay, and then we observe the survival percentage 20 years later. Okay, so these are the studies. And they don't ask the question if you prefer high carb, what is the associated behavior or any other factor that associate with the high carbohydrate habit that may influence your longevity. So this is not a randomized study. Okay, this is observation study. And this is the hazard ratio for survival. High means no good for your survival, right? So those people, okay, and if you look at here, the lowest risk from moderate carbohydrate diet. Okay, so if you look at the population, those people who has the carbohydrate level between 50 to 55, they have the lowest mortality rate. They are less likely to die. Okay. Can you use this as a recommendation for the dietary intervention for yourself? Do you think this data is good enough for you to make a recommendation for anti-aging? Okay, look at here. If you have the carbohydrate less than 20%, it's highest risk from low carbohydrate diet. right? And if you have carbohydrate up to 80%, you raise the risk of survival. Right? But do you convinced by the data? Do you think this data is good enough for you to make the recommendation? Well, this data is certainly valuable, but there are some potential bias, right? So all observational studies are valuable and is narrowing the range of the space of bias, but I still have the bias, right? So we can consider that unless we see randomized animal studies showing the same thing. Right? This is my opinion. Okay, if you look at observational study, which is not randomized intervention study, then the data is good. I want to see this result, but then I want to ask the question, if I conduct randomized intervention study, it shows the same result, then I'm totally agree with you, right? But can you do randomized intervention study in human? Okay, it's very easy to do theoretically, but practically you cannot do it. Okay, you are going to ask people that have 3 different diets, 20%, 50%, and 80%, right? And you want to randomize everybody, right? And then you are chosen to be 20%, and you will be 60%, and you will be 80%, right? And then we can do it for 30 years. Is that possible? It's very difficult to do, right? Theoretically, you can do it, but it's very difficult to get an answer. So you cannot do it, okay? But alternative way is to have animal study. You find short-lived animal. It's not perfect, but if it matches well with the observational study, then we tend to agree, right? Okay, this is very important for you to learn because most of the dietary recommendation by nations, all nations, they are not using this kind of approach. And therefore the answer continuously changing, right? So you see a lot of recommendation from media and they mention this is the recommendation from the nation. And the nation has the expert committee. But why recommendation is continuously changing? Because you don't have the kind of the data match well with randomized intervention study. Okay, so just give you one example. At the very beginning, most of the country, they are opposing high-fat diet, right? And why people are opposing high-fat diet? Well, a lot of people say if you have a high-fat diet, then you are going to have a heart attack later, right? That's what people used to say. And now you can see a lot of high-fat diet animal study. Okay. The people believe high-fat diet is bad for you. Why people think that way? Because obesity is not good for survival, right? And obesity is related to accumulation of fat. And therefore, the most straightforward thinking is, okay, if you have too much fat, that means you have a high-fat diet, right? And today's lecture gives you the idea that high-fat diet doesn't make you obese, and even lower your body fat and slow down your growth. And the reason behind is because high-fat diet is going to give you low insulin. Insulin is the key, right? So you want to understand the limitation of correlational data. Observational data is the correlational data. So you look at a lot of people for a long time, and this kind of condition give you that kind of result. This is correlation. It's not causal relationship, right? Causal relationship, you must get data from randomized intervention study. Okay. And okay, for this data, they have some explanation here. They found that the low carbohydrate diet pattern, they are actually favoring meat. They believe meat are important, protein are important. So that is the reason they have the low carbohydrate diet. Okay, that is what we call the Atkins diet. Right? So you want to be very careful about the media, because the media does not give you, media is influence everybody, right? But you always want to ask the question, are this kind of the diet is coming from randomized intervention study or simply coming from observational study? Okay, let me just provide you the data on low carbohydrate and low protein diet. This is ketogenic diet, okay? Look at here. You have three different kinds of diet. Control, low carbohydrate, and ketogenic. Okay, if you look at low carbohydrate, then you are puzzling. Some people are puzzled. People believe low carbohydrate is ketogenic, but this low carbohydrate has the protein level reach 23%. Okay, and ketogenic diet has the protein 11%. Look at the ketone level right here. K means ketone. LC means low carbohydrate. Okay, this is control diet. So from here you can clearly see that low carbohydrate does not equal to, this is beta hydroxybutyrate, this is ketone level, right? Okay, this is ketone level. The low carbohydrate, high protein diet has low ketone. So it's not ketogenic. So low carbohydrate, but you have a high protein, it's not ketogenic. Okay. But when you have the protein reach the level 11%, this is moderate protein level, then you have high ketone. Okay, make a guess about the longevity. Which one is giving you highest longevity? Control, low carbohydrate, high protein, and low carbohydrate, low protein. Which one has the highest longevity? Low protein, right? The answer is right here. Ketogenic, low carbohydrate, low protein is the yellow, right? So you can see that this is percent survival over time. And obviously, the low carbohydrate, very low carbohydrate, only 5% of the energy coming from carbohydrate, can still give you high longevity. So that also means the ketogenic diet is not life-threatening for anyone. But the condition is only 11%, only half of the protein compared to the other group. Okay. The control group has 21%, LC 23%, and keto only half of the protein. Right? So you see the life prolonging effect of the ketogenic diet. Is that really because of the fat or because of the protein? It looks like it's protein, not fat, right? Fat is probably not important at all. Okay. This is age. Okay, this is the fat mass. Fat mass. You see the low carbohydrate and high protein diet. A lot of people believe that low carbohydrate and high fat diet is going to give you lower body fat, right? How about the result? The result is just not looks right? The result is low carbohydrate, high protein give you the highest body fat. Right? So from here you give very important knowledge that protein is promoting growth. And during growth, one of the side effects is increasing body fat. Right? And people used to think that, okay, body fat must be coming from either fat or carbohydrate, right? From here, you see the most important influence appears to be protein instead of carbohydrate and fat, right? And why people used to think that protein is not a factor?
Because you cannot store protein.
Right. Obesity looks like you are storing excess amount of fat, and people will not think that way. People will not understand how high protein is going to influence obesity, right? So that is the main reason. Intuitive thinking, right? And people already know that insulin is also lipogenic, and therefore some people believe that carbohydrate is probably the cause, right? But from here, you want to abandon both. Looks like a protein is the most important. Okay, this is the insulin sensitivity. Okay, very important data here. Which one gives you the highest glucose, blood glucose, under oral glucose ingested condition? This is OGTT test. What kind of diet gives you the highest glucose response? It's ketogenic, right? It's quite obvious. Very low carbohydrate diet give you the highest glucose response. It's right here. K, ketogenic, give you the highest glucose response. And even higher than low carbohydrate, high protein diet. Okay, do you have any reasonable explanation for this? Very low carbohydrate and very low protein. It gives you the highest glucose response. Where is the glucose from? The blood glucose is coming from two sources. One is when you ingest glucose, then you release, right? Another thing is the hepatic glucose output. So we have two sources to determine the glucose level, right? And they all have the same amount of glucose, right? And insulin sensitivity, this is the data for insulin sensitivity. You inject the same insulin and look at which one has the highest drop in glucose. If you drop faster, that means your body are more insulin sensitive, right? And which one give you the highest insulin sensitivity? Ketogenic, right? The glucose is dropping faster, right? So ketogenic diet give you highest. Ketogenic, low protein, give you the highest insulin sensitivity. But how do you explain the high glucose? It must be coming from liver. Okay, so the liver may somehow adapt the ketogenic diet, and the mechanism to produce glucose in liver is probably elevated. So this is probably the only explanation we can get from the data. Okay, let's come back to the question. High carbohydrate and fat, does both important for your survival? You want to choose high carbohydrate or high fat diet to achieve your highest longevity. Okay. If you look at here, the most important thing is probably not carbohydrate and fat. It's probably protein, right? If you look at it here, low protein intake is associated with the major reduction in overall mortality in the age 65 and younger, right? But not for older population, right? So this means if you have protein and during the weight increasing phase, is detrimental for your survival. Right? But if you enter in the weight losing phase, at the end of the life, situation change. Right? But keep in mind that this is also observational study. It's not intervention study. Okay? So if you look at here, respondents age 50 to 65, the body weight still increasing, okay? Reporting high protein had a 75% increase in overall mortality. So if you have high protein and you are still growing, then it will further promote growth and you will die early. Okay? And this is the follow-up for 18 years. And for fourfold increase in cancer mortality. Okay, so protein is bad for cancer. So you don't want to have high protein if you are worried about cancer. Okay, but conversely, high protein intake was associated with reduced cancer and overall mortality in respondent over 65, right? So this result suggests that low protein intake during middle age followed by moderate to high protein consumption in all adults may optimize health span and longevity. But you want to pay attention on, okay, this is also observational study, not intervention study. It's not randomized. Then you want to find whether there's any evidence that is randomized intervention study showing the same thing. Here, this is the intervention study. It's very famous. It's called Geometric Framework Study. Okay, this is randomized and intervention study. Okay, this is the outcome. Longevity and health were optimized when protein was replaced with carbohydrate and limit compensatory feeding for protein and suppress protein intake. So, okay, another thing. Caloric restriction achieved by high protein diet or dietary delusion had no beneficial effect on lifespan. So that means in the past we already know the fact that if you eat less, you are aging slowly and you can prolong your lifespan, right? Everybody know this. And here, if you further answer, it's not because of the total calorie, it's because of the protein. Right? So you eat less, you are also reducing your protein intake. Okay, so this is important. Okay, then if protein is very important, then I ask you another question. If I only just limit one amino acid, one essential amino acid, can I increase your lifespan? The answer is yes. This is one example. This is restricting one essential amino acid we call methionine. Okay, methionine restriction. Okay, and you can see this is the survival percentage over time. You're just restricting one methionine, then you can survive for longer period. And even the total energy intake is increasing. So if you just limit, if you produce the red chow, the food for animal that has only restrict one amino acid, methionine, then those animals are going to eat more. Okay, so the total energy intake is higher, but it will survive for a longer period. And the reason is because the growth rate is going to slow down. Okay? Okay. If you understand all this, then I would like to ask you one question. I want to see whether you can give the best explanation for this. This is the monkey study. Okay? The monkey study, the CR means caloric restriction by 70%. So the total energy intake is lower by 30%. Okay? And this is the survival percentage starting from here, right? And then you start to see the CR, caloric restriction, will die relatively later. But this effect appears to be vanished at the end of the life. Why this is the outcome? Why you don't see this and you see this?
They don't have enough protein to sustain their weight.
This is probably the answer. At the end of the life, when body weight starts to drop, you don't want that happen as well. And therefore, caloric restriction at the end of the life, it's going to accelerate the cell loss, right? Which is bad for multicellular system, right? So that probably is the correct answer. Okay. Then come back to the question. How ketogenic diet prevent weight gain and promote weight loss? And you keep in mind the ketogenic diet is high-fat diet and very low carbohydrate and small amount of protein. How ketogenic diet prevent weight gain and promote weight loss? It's high-fat diet, right? No carbohydrate. You know it. Why? Insulin, yes. Insulin. How fast is the insulin effect on your body fat? This is the answer. And this is in our seminar, right? Is you give the STZ to animal and to destroy the pancreas, and therefore the insulin level is very low, right? And you see, this is why adipose tissues, it reduced dramatically by how many percent? From here to here, almost 1 gram to how many percent weight loss? In 1 week. It's 80% weight fat loss, right? 80% fat loss can occur in 1 week if the insulin is not produced. So the insulin is the most important determinant of your fat cell, like bone cell as well. Okay, fat and bone. And do you know what happened to what happened to the total energy intake of this animal that has the insulin loss? Look at here. This is the intestinal content of food. Okay, intestinal content of food means how much they eat, right? And you see, for those animal has insulin loss, they are going to eat how many times more compared to the normal animal? This is about 13, right? And this is about 39. 3-fold increase in total energy intake. So I'm going to eat 3 times more if I don't have insulin. But still, I have the fat loss, right? So that means the total energy intake is probably the secondary. The primary determinant is insulin, right, for your body fat. So that explains why ketogenic diet are very effective to cause fat loss. It's high fat diet, right? Okay, these are the take-home message. The most important determinant to body fat and bone is insulin, not dietary fat. The ketogenic diet is very low carbohydrate, high fat, and moderate protein diet. Okay, if people say that the ketogenic diet is low carbohydrate and high protein, it's a mistake. Okay, it's not high protein. Low carbohydrate, high fat, and moderate protein. and which would lower insulin level. So the lower insulin level is very important to decide how much ketone you can get. Okay. And low carbohydrate diet decrease high intensity endurance performance within the first 2 weeks. So it will lower endurance performance. Okay. But this reduced high intensity endurance performance with low carbohydrate diet is reversed by 4 weeks. It suggests you have ketogenic adaptation. So we are able to adapt. Okay. Ketogenic diet can cause social problems because of the bad breath. Because ketone smell is not good. Ketogenic diet with low protein, similar to high carbohydrate low protein diet, may slow growth and benefit longevity. But you don't want to do it when you have unintentional weight loss. Okay, that is not good thing to do. Dietary effect on longevity is mostly mediated by protein. Which dominates cell birth. So actually carbohydrate and fat are less important. It's protein is the most important. Okay. So the macronutrients without nitrogen are less important for longevity than protein. Okay. Okay, now I would like to give you the take-home work. Okay. So all master students here, so some student 可以把它关起来。